Facial nerve is the seventh cranial nerve. It is also called as nerve of the second branchial arch, mean that all of those structures which embryologically develop from second branchial arch will be supplied by facial nerve. The facial nerve have both motor fiber and sensory fiber. That is why it is also called as a mixed nerve. The facial nerve arises from pon, then it have an intracranial course, then it exits the skull through the stylomastoid foramen, and then at the angle of the mandible it divides into 5 terminal branches. To understand the facial nerve branches and distribution, we have to understand that the facial nerve give branches at 3 levels. The first one is within the facial canal. When the facial nerve passes through the facial canal, it gives 3 branches. The first one is greater petrosal nerve, the second is nerve to the stapedius, and the third one is the cauda tympani. The second branch is it gives when it exits from the stylomastoid foramen. It gives 3 branches: the posterior auricular nerve, nerve to the posterior belly of the digastric, and the nerve to the stylohyoid. At the end, when the facial nerve uh, passes through the parotid gland at the angle of the mandible, it gives 5 terminal branches: temporal branch, zygomatic, buccal, mandibular, and cervical branch. To understand the facial nerve in a better way, look at this diagram. The facial nerve have both motor and sensory fiber, and they arises from pon. It then enter the facial canal. In the facial canal, it gives 3 branches: the greater petrosal, nerves to the stapedius, and the cauda tympani. Then it exits from the stylomastoid foramen. After exiting from the stylomastoid foramen, it gives again 3 branches. This is the posterior auricular branch. This is the nerve to the posterior belly of the digastric, and this is the nerve to the stylohyoid. After giving these 3 branches, the nerve passes forward and it enters the parotid. In the parotid gland at the angle of the mandible, it gives 5 terminal branches: that upper temporal, then zygomatic, then buccal, then mandibular, and at the end the cervical branch. So it is all about the facial nerve. If there is still any question, you guys can ask, and stay tuned for more update.